All right, so welcome to today's virtual event on a very timely topic. Are we prepared as we will go with COVID through the winter? I am Mridul Agrawal, member of the board of directors of the German-American Business Council of Boston and founder of iuvando Health, and it's my pleasure to be the moderator today. This is the 6th panel discussion in a series of events organized by GABC in collaboration with the German-American Business Association of California and supported by the German Consulates General in Boston and San Francisco. It's my pleasure now to welcome German Consul Generals from the New England states and California, which is Dr. Sonja Kreibich, Consul General to the New England states, and Oliver Schramm, Consul General to California. Both will offer their introductory remarks to this event. So, Dr. Kreibich, welcome to the stage, and I'll hand it over to you.
Thank you so much, and good morning or good midday, as it is for the East Coast from Boston. I have already been introduced. I'm relatively new on my post. I arrived in Boston in summer, which also means that I lived through the past 2 pandemic winters in Germany, and this makes me qualified to give a few introductory words on the actual COVID situation in Germany. Before I do that, however, I just wanted to remind everybody that New England, particularly the Greater Boston area, is well, many call Kendall Square in Cambridge ground zero in the worldwide fight against the pandemic. As a German, I would add that some German cities, particularly Marburg, also contributed a great deal to the successful fight against the pandemic and the development of vaccines. But of course, the issue of how we deal with this and other pandemics is very much in the minds of scientists in our region. As I said, I've been asked to say a few words about the COVID situation in Germany as we start into the next winter. I believe it's a very volatile situation, and in comparison to the last 2 autumns, I have the impression that the issue is very much in the back of the minds of peoples, but there still is well, as of today, Germany has a 7-day incidence just below 200. For those who are not familiar with this German way of reporting these incidences, that mean 200 cases per 100,000 inhabitants across Germany. But this is just a month ago, this number was at 800. So there was a peak in numbers at the end of September, beginning of October. And we all also know that since reporting has gone down significantly, these numbers do not anymore reflect an actual picture of the rates of incidence among the general population. What is more accurate is the hospitalization rate, which is currently about at 5.7 per 100,000 inhabitants, much higher in the age group among above 60. There it's 15 per, the rate is 15. About 1,000 Germans are currently in ICUs. And But as I said, these figures, well, particularly the 7-day incidence is a very relative one. Currently, Germany also has a public discussion about whether the obligation to self-isolate should be further continued, which shows that well, this discussion has been going on for quite a while. Just a quick look at the vaccination rates. There, I believe we stand at a very good position. 78% have received 1 vaccination, 76 are fully vaccinated, and 62.4 have received a booster shot. The German government is promoting booster shots, but I think people need some prodding at this point in the pandemic. I could also say a few words on protection measures, but I believe that my colleague Oliver Schramm wanted to do that. So a quick look back at the moderator. Whether
yes, I think he's arrived and on the phone right now.
Okay, then I will pass on. But before I do that, because I've also been asked to introduce the participant from the East Coast. So we are very glad to have Dr. Kathryn Hall with us. She is Deputy Commissioner for Population Health and Health Equity at the Boston Public Health Commission. She has a PhD in microbiology and molecular genetics from Harvard, spent 10 years in the Biotech Institute, and now teaches at Brigham and Women's Hospital and at Harvard Medical School. And I'm looking forward to the discussion. Thank you.
Thank you very much, Consul General Kreibich, and I will hand it over now to Oliver Schramm. He's Consul General to California, and I think he'll be joining us by phone because of some technical difficulties. So welcome, Consul General Schramm.
Good morning, everyone. Unfortunately, I'm not sure why Consul General Schramm is not on the call right now, but let me first off thank the German American Business Association of Northern California and the German Business Council of Boston for organizing this virtual event. I'm Beate Antonich from the Consulate General in San Francisco, and it's my honor to welcome California State Senator Dr. Richard Penn, who has been serving California now for the maximum term of 12 years, 4 years in the State Assembly and 8 years in the State Senate. Let me thank you personally, Senator Penn, for your outstanding contributions to healthcare policy and funding in California, and for sharing with us on numerous occasions your California perspective and experience in public health policy, and in particular during the COVID pandemic. Also from California, I'd like to welcome Dr. Scott from Stanford School of Medicine to join the panel today. Let me just speak quickly about our health ministers. Lauterbach already presented this summer this 7-step plan and announced reforms of the German Infection Protection Act, reforms which came into effect last month. So let me just mention some of the most relevant measures. Senator Penn, during our last conversation, during the visit with our Parliament's Health Committee in Sacramento, you noted the power literally for better and worse of social media, which profits from extremism. And in this context of COVID policy, you also underscored the plea of the medical professionals to engage in more positive campaigns on COVID preparedness efforts. And this is exactly what was taken up in Germany with a national public campaign calling on citizens to protect themselves against COVID. So right now, part of this plan, the 7-step plan, is this campaign where we have 84 citizens sharing their stories, representing 84 million people in Germany, and explaining their individual reasons for keeping their vaccinations up to date, wearing masks, and showing consideration for one another. And of course, both unvaccinated and vaccinated citizens should be tested when they show symptoms of infections or when having been in close contact with infected persons. And there have been, Health Minister Lauterbach has been trying to also address the costs of testing. Testing remains free of cost for everyone who needs to be COVID tested, such as when visiting patients. But in the reforms, there have been also ways of addressing the costs as well. Yeah, what else? Let me just finish up with the reform measure. The reform of the German Infection Protection Act aims at protecting, in particular, vulnerable people and groups of society. As it stands, the federal regulation includes now the requirement to wear masks in long-distance public transportation settings, in healthcare facilities, and in hospitals, where proof of negative test is an additional requirement for entrance. Yeah, let me hand over back so that the expert panels can dive deeper into the issues of COVID preparedness right now. So thank you.
Well, thank you very much, Dr. Antonich, for also stepping in on behalf of Consul General Schramm. So thank you very much, Dr. Kreibich and Dr. Antonich, for your welcoming remarks. We are now excited to welcome our distinguished panelists for today's discussion. So I'll just briefly introduce everyone and then we'll go right into the discussion. So I'm honored to welcome Senator Dr. Richard Penn. He is a member of the California State Senate in Sacramento, and as California State Senator, he is the chair of the Senate Committee on Health. Among many others, Dr. Penn serves on the Budget and Fiscal Review Subcommittee on Health and Human Sciences, as well as on the Special Committee on Pandemic Emergency Response. Dr. Penn is a pediatrician by training and has earned a Master of Public Health from Harvard University. Welcome, Senator Penn.
Thank you.
So we have on our panel Dr. Kathryn Hall. She's a member of the Boston Public Health Commission, where she serves as the Deputy Commissioner for Population Health and Health Equity. She received her PhD in microbiology and molecular genetics from Harvard University and spent 10 years in the biotech industry. She then returned to Harvard Medical School, where she receives a master's in public health from the Harvard Chan School of Public Health. Dr. Hall also serves as assistant professor at the Brigham and Women's Hospital and at the Harvard Medical School. We're delighted to have you with us. Dr. Hall, welcome to the panel. And our third guest is Dr. Jake Scott. Dr. Scott is a clinical assistant professor at Stanford School of Medicine, specialized in infectious diseases. As a medical doctor, he attends patients with general infectious diseases in the inpatient and outpatient settings with a special interest in COVID-19 and HIV. Dr. Scott is also highly involved in teaching. He trains Stanford residents and medical students and has lectured on various infectious disease-related topics such as COVID-19 and the dangers of antibiotic overuse. Welcome to the panel today, Dr. Scott.
Thank you.
So thank you all for being here today and joining us for this timely discussion. A quick note to our viewers and guests: if you have a question for the panelists, you can type them into the chat window and we will try to pick them up as many as possible throughout the hour. So without further ado now, we'll start. So thanks again, Consul Generals, for your welcome. And so I think the topic today is really, couldn't be timelier. Millions of Americans will be traveling next week to be together with family members for Thanksgiving, and the same will be happening again in December for the holiday season, and not only in the US, but throughout the world. So let me ask you this somewhat maybe provocative question right at the outset. Do you still care about COVID? I know this is a very, broad question, but I would ask you to answer this in a couple of short sentences, and then we will dive into the topic a lot deeper as we move on to our discussion. So, Dr. Penn, would you like to go first?
Sure. Well, I think we should care because hundreds of Americans are dying every day of COVID still. Hundreds. And that could increase if we don't continue to try to do mitigation. So we need to increase our vaccination rates, but vaccines alone are not enough. But certainly they will help a lot particularly in terms of death rates. They reduce hospitalization, reduce death. They do actually decrease transmission. They don't eliminate it. That's why we need to do other things like masking, better ventilation, and so forth to mitigate it. Right now, pediatric hospitals are full, not of COVID, but of many other infectious diseases. If we have a COVID surge on top of that, and so it's a reminder, kids do get COVID and they can transmit COVID. There's a lot of misinformation out there. In fact, I would say the infodemic is as dangerous as the disease itself when it comes to this winter and what's been going on.
Yes, Dr. Hall, what's your perspective as a public health official in Boston?
Perhaps there's no better time to be really passionate and care about COVID, because we actually have the space to plan for what arguably will be a surge come the holidays. As you just said, we're about to get together with our families, travel across countries, maybe even travel across the world. And we know from the last 2 years what's going to happen. We know we're going to see an increase in the rates of COVID. And what's interesting, as Dr. Pan said, is we also have now RSV and other viruses and other conditions that are affecting certainly children. And so now is a time when we can actually get out ahead of it. We are seeing COVID, we watch COVID in the wastewater in Boston, and we're seeing it every day kind of rise slowly. And so, yes, it's a really important and critical time to be thinking about COVID and be preparing for what's to come.
Thank you, Dr. Hall. Dr. Scott, maybe you can comment also on that question from your work with patients.
Yes, I certainly care about COVID still. I do think it's important to recognize that the disease itself has changed quite significantly, fortunately, for a number of reasons. One, population immunity has increased, obviously. Two, I think that Omicron is intrinsically less virulent. So on the inpatient side, patients who are hospitalized with COVID are faring significantly better overall. But there's still a large amount and very high levels of virus circulating in the community, affecting severely immunocompromised patients, frail and older patients, or people who still need public health to do everything it can to support them. There's still a lot that we need to better understand about post-COVID conditions, such as long COVID. So yeah, we certainly shouldn't stop caring about COVID. The impact will continue to be felt.
Great. It seems that there's broad consensus among three of you in terms of caring about COVID. So maybe before we, go and look into the future, it would be very interesting if you all could highlight, what you've learned or what the pandemic lessons were from, the past almost 3 years now. And then we can see how we can use those lessons to look into the future.
So I don't know. Okay, maybe I'll start. So I would say, well, there's many lessons, but three particular points I want to make. First of all, the infodemic, I made reference to that, right? In fact, when you look right now, in the beginning, due to structural racism and other disparities, we saw higher rates of death in particularly Black, Latino, Indigenous, including Native Hawaiian and Pacific Islanders, right? Actually, now the death rates are climbing among whites, and particularly in people of particular political persuasion, right? Because they've been fed so much misinformation or disinformation, they're not getting vaccinated. They're opposing. They've been opposing all sorts of mitigation, et cetera. And so basically, disinformation kills. Let's just be blunt. Disinformation kills, and it's killing people right now in the United States, and I'm sure it's killing people around the world. That needs to be addressed if we were going to try to reduce the death rate, so that people are empowered with accurate information. So, for example, I just want to point an example. There's a question in the chat about VAERS. VAERS is a voluntary reporting system. There's no evidence that those reports are actually connected to the vaccine, right? It's a sentinel system. It's not a causation system. And so you have people saying that, oh, look at the VAERS reports. That is not an accurate way of looking at the safety of the vaccine, right? And then they cite a study talking about, that they're underreported. Well, actually, the evidence does not show that serious adverse events are underreported in VAERS. Actually, the problem is we have an overreporting of things that are not associated with the vaccine, and then people using that to claim the vaccines are not safe. So this kind of disinformation needs to be addressed. The other thing I would say is that since it's the German-American Business Council, contagious diseases, including COVID, have very significant economic effects if they're not mitigated. We just saw an article in the Washington Post talking about a record high of families, parents who've had to stay home because there wasn't childcare, kids are getting sick in school and childcare, et cetera, right? So this is having a tremendous impact on our economy when we don't try to mitigate the disease. We think about long COVID. I appreciate Dr. Scott bringing that up. We see evidence around the world that our workforce is being disabled by long COVID, right? Significant portions of our workforce are being disabled by long COVID. That has a huge economic impact. It's driving down productivity. It's making workforce shortages. I think anyone who's an employer who's trying to find someone to employ is struggling. So we have low employment rate, even as our economy is going down, we have low unemployment rates because basically that's the percentage of people seeking jobs. Finally, we need to invest more in public health in a consistent manner. We've seen a lot of failures of our public health system, but frankly, a lot of that's because of underinvestment. Our public health workforce is burnt out. They're showing high rates of PTSD, as well as healthcare professionals. We need to rebuild our public health infrastructure and workforce. Otherwise, when the next wave of whether it's a variant or another pandemic comes around, we will see, unfortunately, the same terrible results we saw with COVID.
Thank you, Dr. Pan. Yeah, I think very interesting, basically, to learn about your take on this. And you've already, I think, mentioned many important topics and already connecting them with some action items. Maybe Dr. Hall, also being in the Deputy Health Commissioner, maybe you can comment on what the U.S. National COVID Preparedness Plan is about. President Biden has issued a 40-page COVID preparedness plan earlier this year. What do you think, is it about in essence, and how helpful is, such a national COVID preparedness plan?
Absolutely. And, I think based on, just to kind of echo what Dr. Pan just said about this reactogenicity and fake information and this infodemic and its impact on us, we really know a lot today, despite all the kind of misinformation, on how to not only track, but prevent or minimize the impacts of COVID. And I think the prevention plan really speaks to many of these preventative measures, whether it's getting vaccinated. And it's been, to your earlier question, like what have we learned? I think it's been really impressive what we've been able to do in developing vaccines on a short turnaround time to really kind of respond to this virus that's continually changing. We can be kind of responsive in a way that we've never been able to, and yet that's been kind of cast as somehow a suspicious thing. This is, at its best. Masking is another really key strategy that's outlined in this plan. And we recently, at literally last week, published a paper in the New England Journal of Medicine on the effectiveness of masking in public school settings. This is, definitive data demonstrating the power of masking. And masking is one of the most basic, oldest, fundamental strategies we have to prevent the spread of COVID. And historically has actually been a lightning rod for descent for hundreds of years. So this is actually not new. But here we are today, and we now have evidence that masking works, and yet we still have pushback against it. I think that, you know, the disaster preparedness or the surge planning plans really allow us to not just prevent COVID with vaccines, masking, and, you know, antivirals such as Paxlovid, but it also prepares us to track and to have good metrics to know when we need to take action and really kind of double down on whether it's masking or vaccines with mandates, which are incredibly unpopular, but very effective, as we've seen.
Yeah, thank you very much. I think that's right to the point, I think, where we are right now. So, Dr. Scott, there's a question for you, you know, being on the front lines now 3 years into the pandemic. Could you comment, you know, what the frontline challenges for doctors and patients are right now? Is there anything we're seeing now or we may see in the future what we have not seen before?
Well, so let me just put things into a little more context in terms of my perspective. So in 2020, you know, it was just absolutely just tragic. The number of patients that succumbed to COVID due to COVID-related respiratory failure, specifically involving the lungs, the lower respiratory tract. And all sorts of people were affected. I saw, you know, over 100 patients die from COVID, and that included some who were relatively healthy and relatively young. Once the vaccines were made available in early 2021, the cases of severe COVID and the number of deaths involving vaccinated individuals just absolutely plummeted. But in 2021, the vast majority of patients that I saw were unvaccinated who had severe complications. So I would say, just to go back to the earlier question, the most important lesson that I learned from last winter is really trying to make sure that we're vaccinated the unvaccinated, because they do still remain at risk. As of now, those who are being hospitalized with complications directly due to COVID are primarily older people, I would say over age 80, who have underlying chronic medical conditions such as congestive heart failure or chronic obstructive pulmonary disease, COPD, and the COVID will oftentimes trigger an exacerbation of one of these underlying medical conditions. So it's going to be extremely important to protect our vulnerable older populations as well as severely immunocompromised patients. And I also echo what Dr. Pan said about investing more in public health. So that really needs to be prioritized more. So what the challenges now that we're dealing with on the front lines are very different from the challenges of 2020. We're no longer dealing with ICUs that are overwhelmed with COVID patients who are intubated, thanks to higher levels of population immunity and changes in the virus, which is great news. We're no longer dealing with shortages of personal protective equipment, which is also great news. One thing that, and I've been working in the hospital full-time throughout the pandemic, one thing that we're starting to see and have seen over the last few months is complications related to inadequate medical attention, I think, because of the fear of going to the hospital and acquiring COVID. So I do want to emphasize that it's extremely important that people, you know, have regular visits with their doctors and, you know, do the basics of exercise and healthy living. And the other challenges are more sort of nuanced and related to some of the newer variants that are resistant to some of our COVID therapies, including the monoclonal antibodies in particular. So we certainly need to advance our research programs and develop new antivirals that evolve with the evolving variants.
Yeah, excellent. Thanks for highlighting, you know, what's, you know, the most pressing issues today as compared to, you know, in the previous years. I think there are many differences, as you stated, and the pandemic now is not the pandemic anymore as it was, with really different challenges. Dr. Pan, there was a question from the auditorium, which I'll just take into it, because I think you and also Dr. Hall most appropriate to answer it. So the question here is, or was, what is the responsibility of senior government officials that state the pandemic is over when the evidence clearly shows otherwise? So I think that question is very, relates very much to the issue you pointed out with the infodemics. Could you comment on that as well?
Yes, I appreciate that question. I'm an elected official. I'm a physician, but I'm also an elected official. And one of the things that I said, actually, even going earlier on in the pandemic, was that the person at the podium probably shouldn't have been the elected officials. Now, we should be supporting the public health officials who are communicating to the public and showing our support and getting them the resources. But the public health officials should have been the ones up front messaging to try to reduce politicization, to be sure we try to focus on the science. We also need to be sure that as the public health officials are speaking, that they also provide background information to the journalists and the media with some of the nuances, because there's lots of nuances, lots of we don't knows, especially earlier on, but even now, right? And that hopefully that may have helped, although the challenge has been also social media. So there's a social media cycle, and that cycle unfortunately has really amplified misinformation and disinformation. In fact, some of the revelations coming out of social media from people like Frances Haugen, the Facebook whistleblowers, and others, researchers have shown that disinformation gets amplified many times. I think they're saying about sixfold more than accurate information, regardless of sort of political persuasion, whatever else. So it makes it very hard, because if that's the major source of news for many people, and many polls show that social media is the primary source or one of the major sources of news for a large portion of the population, then they're getting fed a lot of misinformation. And if you just hear it over and over again, you start to believe it. And so that is a little separate from the public officials. But I also feel that too often, and we saw this earlier on in the pandemic, where the main messengers were actually not public health leaders, and that may have also contributed. And that combined with the underinvestment. I mean, I realize people are saying, for example, CDC here in the United States has sort of bought into the messaging as well from some leadership, et cetera. We've seen that in both administrations, et cetera. That's still problematic as well. But I do think overall, it's important that public health messaging come from public health experts and officials with support from elected officials, showing, in our sort of, as leaders of the community, that we support our public health leaders.
Yeah, thanks for being very clear on that. Dr. Hall, a question which I think was already, or a topic which was already touched upon by Dr. Pan, speaking about, health disparities. He mentioned that, in the beginning, the death rates and vaccination rates were very different between, Black people and others. Can you elaborate a bit on what the health disparities in COVID look right now, and what you would expect them to be in the future, also through the winter?
Yes, there are a lot of factors, driving these disparities. One of the key ones, of course, is kind of this historical structural racism, which, whether it's gentrification or redlining or, environmental racism or historic underinvestment in certain neighborhoods, we see that neighborhoods have today overcrowding, or schools that have poor ventilation systems, or low access to healthcare, good healthcare, and even low access to testing and vaccines. Certainly in Boston and across the country, there have been enormous efforts to increase access not just to testing and vaccines, but to healthcare, and to really educate people about the benefits of vaccination, the benefits of masking, We've certainly made antigen tests widely available here in Boston, and we know that this is a trend across the country. So it is, I think all of these efforts have had a significant impact, but it does still remain a fact that people in historically marginalized neighborhoods are still seeing higher rates of COVID, more severe experience of COVID, in large part, we think, because of underlying health conditions that are related to chronic diseases, related to this kind of structural historic underinvestment in structural racism. So we're still, this is still a very big problem, and it's a big problem across the country. And it does not look as if it's going to be, resolved particularly anytime soon. It does call for reinvestment, and going back to the infodemic, it does call for a very strategic initiative to educate people in a way that is respectful, respects their belief system, and also their understanding and perception that they have gone out and gotten the information, they have done the research. Granted, it's been in places that are kind of where misinformation is kind of seeded and planted for them. So they're not getting necessarily the best information, but they are getting information because of this, kind of paradigm. We at the Boston Public Health Commission have mounted a campaign called True, but Also True. And what true and also true is, true that, for instance, the vaccine does not prevent COVID, but also true, the vaccine does reduce the severity of the disease. And so we're trying to kind of counteract this infodemic with recognizing that people are going out and doing the work to get the information, but that there's more information that they can get. So in a nutshell, we're, these health inequities are with us, they remain with us, and we really, I think, need to put the investment in many resources on multiple levels to address them.
Yeah, thank you, Dr. Hall. I think very insightful to learn about your experiences, and also to learn about a specific program like True, trying to mitigate some of the issues you mentioned. I think we'll switch or shift the topic a bit, and I have a question for Dr. Scott, which is related to COVID variants and mutations occurring. And I think that's something which we've all been dealing with and reading about, and it's also important to stay with the facts. So Dr. Scott, what's your take on how much longer do you think those mutations will play a critical role in managing the pandemic, and anything you believe science has provided to reduce the mutational evolution for COVID?
Yeah, so viruses mutate. It's just what they do. It's inevitable. So as long as viruses are infecting organisms, they are replicating, and as long as they're replicating, they're going to mutate. So just like the sun rises, viruses mutate. So it's important to keep that in mind and have that context. This SARS-CoV-2, I think, has mutated more dramatically than many of us anticipated. There were, I think, more subtle differences between the variants pre-Omicron. There were variants that became more transmissible, and there were variants that became more virulent. Oftentimes there are mutations that don't confer any difference in the way in which the virus behaves. But sometimes there are differences. So with Omicron, there's been evidence that it replicates much more efficiently in the upper respiratory tract, which might explain why it's so much more transmissible. But there's also evidence that it replicates less efficiently in the lungs, which could be a trade-off and explain why it leads to less severe disease. The subvariants of Omicron continue to be increasingly antibody evasive. They are able to sort of dodge our antibody-mediated protection, but it's important to acknowledge that no variant has developed or occurred that has been able to escape protection against severe disease, which is mediated by cellular immunity. But when it comes to infection, there are new variants that we're dealing with right now. About 50% of the circulating variants are BQ1 and BQ11, and those are not going to be effectively prevented with our preventative monoclonal antibody Evusheld, which has been just a wonderful tool for preventing infection amongst our severely immunocompromised patients. And these variants are also going to be essentially resistant to bebtelovimab, which is our one monoclonal antibody that we use for treatment these days. So that does pose a challenge, and we'll need to continue to develop new monoclonal antibodies. The other treatments, remdesivir, Paxlovid, should work just fine against the current variants. But as far as how we prevent variants from, or how we prevent or slow the evolution of the virus, basically just by slowing down infectivity. So as long as viruses are infecting people, they're going to mutate. So if we can reduce the number of infections, then we can reduce the probability of viruses mutating. But this virus is here to stay. It's ubiquitous. It's established itself as an endemic virus. And I'll also say that there's evidence that some of the variants have evolved in severely immunocompromised patients who were unable to clear the virus because it just continued to replicate. And so for that reason, and for many other reasons, it's critical that we do everything we can to better protect our severely immunocompromised patients. But vaccines still help prevent or reduce the risk of infection, and of course mitigation measures, and those are going to be critical tools for slowing down the development of new variants.
Yeah, excellent. I think that's very, very important. All the points you raised. There's been a question in the from the auditorium, maybe asking for if you could define who is considered immunocompromised, because I think we talk about a lot about this more vulnerable population, and we us all being medical doctors, for us it's clear, but could you just briefly define again how you see immunocompromised patients?
Yeah, that's such an important question. Thank you so much. So there really is a wide spectrum, right? So those who are severely immunocompromised, who are succumbing to severe COVID despite having been vaccinated and boosted, make up a small minority of the population, roughly 3% according to the CDC. And these are primarily patients who are on chemotherapy for cancer, or are on immune modulating therapies for rheumatologic conditions like rheumatoid arthritis, or are transplant patients, stem cell or organ transplant patients. So, there are other immunocompromising conditions such as diabetes, lupus, etc., which unless those patients are also on some of these immunosuppressive medications, I wouldn't group that with the severely immunocompromised patients that are still succumbing to complications. So it's essentially transplant patients and patients on chemotherapy and patients on immunosuppressant medications.
Great, thanks very much for clarifying. I think that's very clear now. Dr. Pan, a question for you. A year ago, we hosted a panel discussing about COVID testing, just prior to the holiday season. And so I think it would be very interesting to the audience if you could comment, what role does testing play this year? You know, what about free public testing sites here in the US? Seems to be, you know, less offered than in Germany. Do you think there should be more, or what's your take on that?
Well, I mean, I think the purpose of testing is to not only, of course, for you to be informed about your own COVID status, it's so that you also are more aware of trying to protect other people around you. So I appreciate the question about who's immunocompromised, but as you walk the street or ride the airplane or the bus or go into a public place, you don't know who around you is immunocompromised. And so the question is that are people immunocompromised? Do we think that they belong in our society? Or should they have to worry about getting very sick or dying because the other people in that space aren't doing their part to try to keep everyone safe? I think that's something we need to really think about from a public policy standpoint. So in terms of testing, we should try to make testing as available as possible so that people are empowered with information on what their status is. Not only, of course, for their own protection, but also for the people around them. So we can, again, reduce that spread of disease, right? So it's a multi-layer approach. Vaccinations will decrease your likelihood of getting infected. It doesn't make it zero. That makes you less likely to transmit. Wearing a mask will make it less likely if you happen to be positive, you'll transmit. Of course, makes it less likely you'll catch it from somebody else, right? Testing, being aware, and therefore knowing if you're positive, you're isolating yourself so that you're not transmitting to other people, also so other people in your household as well. So it really comes down to, are we willing to say that we are in this together, right? This is not, public health is about, we're all in this together. It's not about, oh, well, it's only about me, right? And I think when it comes to testing, I think the widespread availability of low cost or frankly, free testing, I think it's going to be helpful to give people information about themselves. We're not doing a sort of a consistent, with home testing and so forth. In terms of, we already talked a little about case rates and so forth, right? I mean, people aren't reporting these to health departments, so our data is really going to be dependent on more like things like wastewater testing and other types of measures now. But testing itself, hopefully will empower people to make the right kind of decisions so they can protect not only themselves, but the people around them.
Great. Yeah, I think that is very much in line what is important going forward. Dr. Hall, there was a question from the audience, since this is also a transatlantic forum. And maybe you can comment as together with Dr. Pan and also Dr. Scott. I think all of you have different angles on this, maybe through your work, but how important is, working with your counterparts in other countries, in Europe, in Germany, on combating, COVID now and in the future? Are there specific formats, you all are participating in, to enhance your work, more on a global level as well?
I think this is critically important. At the Boston Public Health Commission, we don't do it enough, which is not to say at the state or federal level there isn't more contact. We certainly do a lot of reading and studying because we noticed, what happens in Europe and Israel usually comes our way sooner or later. So we basically track the information to kind of understand and prepare and look at what preparations are being done or what approaches are being done there. But we certainly would, I think the question was, we could certainly benefit from speaking a lot more with our counterparts in Germany and in Europe in general.
Yeah, I think that when it comes to genomic surveillance, in particular of variants these days, it's essential that we have international cooperation and that we share our resources to, be able to act more quickly in response to, say, new variants, and to collaborate on trials investigating therapeutics, vaccine effectiveness, et cetera. So, I mean, pandemics are obviously global in nature, and it's critical that we continue to collaborate on a global level,
And I would say is it's certainly contagious diseases don't stop at political borders, right? They don't stop at political borders. Certainly, countries can have different policies that may mitigate certain things, but they don't stop at political borders. The other thing is that certainly, and again, appreciate this opportunity to talk to the German American Business Council, that as we have global supply chains and trade and tourism and so forth, and people crossing borders. And I know that Germany's part of the EU, which believes in open borders within the EU, right? That in order to protect that, we need to work together on stopping contagious diseases. And not only, of course, either within the EU or within the United States, but also around the world. As long as there are people in the world who don't have the opportunity to get vaccines, that don't have the opportunity to get to be involved in mitigation, the disease will continue to exist. It may be less in certain parts of the world that have those access, but it will continue to exist. And we see this with COVID, right? So we need to work together throughout the whole world, and certainly people in the U.S. need to work with their counterparts in Germany and other parts of the world, and the leaders in Germany, vice versa. We need to work together. One thing about public health is it is a collective activity. Let's just put it out there. All right, individualism has its place, but if we want to stop a contagious disease, we have to work together. And when we don't work together, the virus is relentless in taking advantage of that. It doesn't have a brain, but the mechanisms are relentless in taking advantage of that, whether it's development of new variants because we have higher rates of infection, spread, et cetera. So let's work together. And that's why I've been proud to work with the Consul General here in San Francisco, as well as with I've met with legislators and other people in other parts of the world, other countries as well. It is a whole world, all of humanity effort that we should be engaged in.
No, great. Thanks very much, the three of you, to give your perspective on that. There's been a question which I think is also kind of in the news quite a lot these days. It's about the nasal vaccines, since India and China have approved their nasal vaccines. Could you all, the three of you, comment on how you see them and their role in kind of moving on with the pandemic? Who'd like to go first? Otherwise, I'll pick someone.
I can.
Dr. Scott.
Yeah, thanks. Well, again, I want to emphasize that it's important to have realistic expectations as far as what the vaccines can do, right? So to expect a vaccine to prevent infection caused by a respiratory mucosal viral illness is a really tall order. The immune system has to respond basically after an infection develops. And so in my mind, the primary goal of COVID vaccines is to prevent serious illness and prevent death. And they do a remarkable job at that. And that protection is long lasting. When it comes to protection against merely becoming infected, initially early on, when the first mRNA vaccine data was made available, there was a lot of enthusiasm because, we saw that, there were rates of 95% protection against symptomatic illness. But that, is going to wane inevitably. That's just how the immune system works. So, The advantage of a mucosal vaccine or a nasal vaccine is it stimulates antibodies in the upper respiratory tract that can act more quickly after an exposure. I think that it's a really important area of research. I think that it will take a while before we have, clear data on the efficacy of those sorts of vaccines. I also think that as more and more people develop hybrid immunity, which is immunity generated by the combination of vaccination and infection, it's going to be less sort of a priority, at least in my mind, to develop effective mucosal vaccines for COVID. But in the future, it would certainly be wonderful to have at least maybe a combination of vaccines that help reduce the risk of infection and that also, stimulate robust immunity against serious illness. But for COVID vaccines, I think that, boosters certainly help reduce the risk of infection for a period of time. But I think what's most important is that protection against serious illness is definitely conferred by the currently available vaccines.
Excellent. Yeah, thanks for being so clear on that. I think in the interest of time, I would love to hear, Dr. Pan and Dr. Hall's perspective on the mucosal vaccines, but maybe we'll do a very quick wrap up, questions round, because I think that's also kind of interesting to everyone. Maybe if you all share, your take-home message, for our today's topic, and just give what is your recommendation for the winter and holiday season for all of us. Dr. Hall,
sure, I'm happy to go first, and I just want to say quickly that I think the nasal vaccines are really kind of an interesting approach to meeting people where they're at. People are afraid of the needles and the vaccinations, and this is one way perhaps to limit the high, side effects, at least associated with the belief that you're going to have side effects. So, in wrapping up, I think it's really striking that you have here representative from medicine and the hospitals and clinical settings, representative from the government and the importance of policy here, and a representative from public health. I think it really kind of speaks to how many different types of people we need at the table and in the field to really address this pandemic. I think we know enough to know that, as you said, when you opened, that the holidays are coming and we're probably going to see a surge, and we have the tools to minimize the impact of the surge on us economically, on our health, and on our communities in general. And one of the easy ways to do it, obviously, is masking. And I'm happy to put the link to the paper with, I would say, one of the definitive studies of the impact of masking, certainly in the school settings. And it's an easy way to really limit the spread. If we even coming back from wherever we are for our vacations, just mask for 2 weeks for one quarantine period to really kind of put a dent in that curve. And so I would leave you with that thought, is that, and I think Dr. Pan touched on it really nicely when he said that we do it not just for ourselves, but for our community, because we are only as safe and as healthy as we all are safe and healthy. So thank you so much for inviting me to represent public health here.
I think you're still muted.
Thank you so much. Yeah, sorry, Dr. Pan. Maybe you can share your brief take-home message and most important recommendation, and then Dr. Scott, and then I'll just wrap it up.
Sure. Yes. Well, first of all, I second what Dr. Hall said. So do the things you can do for yourself to protect you and the people that you're going to be with over the holidays. Get vaccinated if you haven't, and that's not just COVID, that's flu vaccine as well. We need to try to decrease all these respiratory infections that we can try to prevent. I think, masking when you're in public places, particularly before you go visit, if you're going to travel and visit relatives or friends, to try to reduce your risk of actually catching the disease for that 2-week period before. I guess we have Thanksgiving coming up already, so that's less than 2 weeks, but then when we have the winter holidays as well, Christmas, New Year's, depending what you celebrate, again, I think when you're in public spaces, that reduces the chances both of you getting it, but also transmitting in case you do end up positive. And then I guess I'd also say is that if you're on social media, for those who are still on Twitter after Elon Musk took over, or Facebook or whatever else, please, 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 when you see something that you don't think is correct, don't share it or retweet it or repost it. Don't amplify it. Don't amplify misinformation. Okay, so if you see something and it's like, I'm not sure whether this is true or not, if you don't have time to look it up, just don't send it to your friends. Okay, and let's not amplify misinformation, but let's have a safe holiday. Let's have a safe winter. You can do everything you want to do. There's nothing that you should not be able to do, but you can take some very simple steps, like getting vaccinated, like wearing a mask in public spaces, that can help not only yourself and your family, but the whole community.
Dr. Scott, maybe you can just briefly say anything if there's anything left. Otherwise, okay.
I'll definitely echo what Dr. Pan and Dr. Hall both said. I also want to echo that it's just obviously very important to stay home if you're sick. If visiting family and you're developing symptoms, don't rely on a single home rapid test. They're often negative during the first day or two. They're still reliable, and addressing one of the questions from the audience, yes, the tests do still detect infection caused by the variants. But if you're symptomatic these days, try to stay home if you're sick. That is a luxury for some people, so it's going to be very important for employers and governments to support paid sick leave. And then the last thing I'll say is, I just cannot emphasize enough the importance of increasing the uptake of primary COVID vaccines in particular, as well as boosters and flu vaccines. Flu vaccine uptake has been quite poor relative to previous years, and it's very important that we encourage more people to get flu vaccines right away. So thank you so much.
Thank you so much. I think that was fantastic. Very specific, take-home messages: getting vaccine, wearing masks, staying at home, and also, don't spreading misinformation. I would like to thank our fantastic panelists for the engaging discussion, and also the audience for being so active on this important topic. Thanks also to GABC Boston and GABA of California for organizing today's events, as well as to the German consulates in Boston and San Francisco who supported this event in many ways. Please also note the upcoming events scheduled by GABC on the right-hand side and GABA, and make sure to reserve your spots to attend. If you would like to have more information about GABC and GABA, you can also find the contact information for both organizations right here on the website. So really enjoyed being part of this panel today, and we also wish everyone a safe, a healthy, and still festive winter and holiday season. And thank you so much for joining today.